3248, please.
Mr. Speaker, sir, I'm informed that since the outbreak of the COVID-19 pandemic in Mauritius, a protocol for the care and treatment of patients infected with COVID-19 has been prepared in light of international literature and findings. The protocol is regularly updated as new evidence emerges and according to WHO recommendations. The protocol used by my ministry has been devised by a panel of experts comprising doctors holding specialist qualifications in internal medicine, infectious diseases, gastroenterology, geriatrics, emergency medicine, anesthesia, nephrology, gynecology, obstetrics, pediatrics, and microbiology. The latest version of the protocol dates back to 25th February 2021, and this version was in use for the period end of March to beginning of April 2021. The patients are discharged in line with this protocol. Mr. Speaker, sir, I'm further informed that this protocol, similar to other medical protocols, provides guidance for the care and treatment of the disease based on the medical history of the patient, age, presence of comorbidities and other immune deficiency, as well as in relation to the clinical, biological, and radiological status of the patient. The protocol also establishes the admission and discharge criteria of patients based on, inter alia, the stage and severity of the illness and the clinical and biological evolution of the patients. Consequently, a protocol for the patient's care and treatment needs to be adopted by the treating doctor in light of the situation of each patient. In line with the established protocol, an asymptomatic patient will undergo a PCR test on day 7 and day 10, and the patient will remain in the treatment center as for at least 10 days. The patient will be allowed to leave the treatment center only upon 2 consecutive negative PCR test results. In case the patient is tested positive for COVID-19 on day 10th, a PCR test will be carried out every 3 days. When obtaining a negative PCR result, the test will be repeated at least after 24 hours, and upon 2 consecutive PCR tests, the patient will be discharged from the treatment center. Mr. Speaker, sir, I wish to inform the House that there is a panel of experts whose mandate is also to determine and decide upon the release of atypical patients, upon the verification of criteria like age, clinical status of the illness, clinical status of the patient, immune status, length of admission in treatment center, clinical status on the decision-making day, the patient's serological status, and the PCR test results. Additionally, the panel will then have to take a decision on these particular cases, and the decisions will be based on the criteria specified earlier and including the cycle threshold CT. The CT value corresponds to the number of amplification cycles needed for the detection of the genetic material of the virus. The greater the amount of amplification cycles needed corresponds to very limited amount of genetic material present. When there is only traces of the virus, more amplification cycles will be needed for detection. This means that the CT value is high. At this stage, for a single patient, the CT can sometimes be negative or considered as being positive, but with CT values which are highly positive. This will once more indicate that the patient is no longer infective. I'm further informed that the above applies for patients who have been tested positive for COVID-19 and who are admitted in treatment centers. Regarding patients who have been tested positive in quarantine centers, they are immediately transferred to treatment centers until the end of treatment.
Monsieur le Président, peut-on savoir de l'honorable ministre, est-il informé qu'il y a au moins une personne qui a passé 17 jours en quarantaine à l'hôtel La Pirogue, d'après toujours les renseignements qui me sont parvenus, et qui a été testé positif et qui, malgré tout, a été autorisé à rentrer chez lui. Est-ce que l'honorable ministre est au courant de cet état de choses? Parce que cette information a largement été véhiculée dans les médias.
Yes, Mr. Speaker, sir. This the honorable member is saying is that's right. The patient may have a positive test after he has been discharged, but this is based on the CT values. CT values for patients who have been tested positive more than maybe 2 weeks, 3 weeks, 4 weeks, that CT values will indicate whether this positive test, they are still infective or not. And at the same time, we have to see whether this patient has already the serological status to be discharged. So based on serological status, positivity of the patient, and the general condition of the patient, the decision being taken by the expert who decide amongst to discharge or not the patient.
Monsieur le
Next
Président,
question.
l'honorable ministre peut-il nous dire si, une fois autorisés à quitter le centre de traitement, ces personnes qui, justement, ont été testées négatives, donc autorisées à partir, est-ce qu'ils ont un protocole à suivre avant de pouvoir circuler normalement?
Normally, Mr. Speaker, sir, the protocol is the patient has to stay in isolation for 1 week before they are being allowed to move to go outside. But at the same time, we have to patients before being discharged, after they've been discharged, they've been followed on phone. For any problem, they have to contact the treatment center so that the appropriate advice being given.